Thank you everyone for joining us today. This is a very special session of the Advocacy Exchange. I'm Lauren Listowskis, the Vice President of Community for Grit Health, and I'm really excited to be here with you all today. Before we begin, I want to take a moment to thank our ASL interpreters today, Emily Cook and Mackenzie Valles, for joining us. For information on how to pin them to your screen, please look for instructions in the chat. We know that August is a time of the year that can be pretty tricky for some people. For those of us in the Northern Hemisphere, we're at the halfway point of summer. With fall just around the corner, a lot of us, like me, are trying to enjoy another month, hopefully of more relaxing activities, summer hours if you're lucky, and good weather. But thoughts of normal life may be starting to creep in for you. It can be a lot to mentally balance, thinking about what you've done with your time during the summer, alongside with what you wanted to get accomplished. One of the things we all know about advocacy is that even if your schedule looks a little different from others, the work never really stops. People's issues in healthcare don't get a vacation. They don't know what month it is. And that can take a huge toll on anyone who's living with disease, taking care of people who live with disease, or advocating on behalf of people who truly need support to survive, and hopefully more than just survive, actually get to thrive. We all know that life's not easy for anyone, but there are different types of challenges for those who work in a healthcare related space. There are mental, physical, and emotional stresses that affect each of us. And it's critical that we all be authentic with ourselves and recognize that our own mental health and well-being is important. We can't be at our best for other people if we're not taking care of ourselves first. It's for this reason that we wanted to do this session for the Advocacy Exchange. We know that each of you is working on behalf of others, and we want to take this time together to encourage you to be your own best advocate and focus on you for a change. I'm a cancer survivor, caregiver, and advocate. My professional role at Grit Health is centered around helping people feel connected and supported as they're facing challenges and just trying to make it through each day, wherever they might be in their cancer experience. At Grit Health, we truly believe in being authentic, and we always invite people to share what it's really like to be going through cancer, whether that's the good, the bad, even the ugly. I'm sure a lot of you here today can really relate when I say being an advocate and an empathetic human can really be emotionally daunting. We're always investing so much of our time and self into others. I know I found it can be truly difficult to hear what people are going through and to sometimes feel like we can't help in all the ways we'd really love to. Everyone here today is doing our best to make people's lives better. Sometimes it might feel like a lot, especially when there's so much that we don't have control over. So for me, mental health and balance are really important. I know I need to be in a good place with myself, so I'm really able to give myself and help others in the best way possible. And I'm sure a lot of you can relate to things I just said. So I'm really thrilled today that we are going to focus on how we can all take some time to think about how we can rebalance and recharge ourselves. And we have the perfect person to help guide us on this journey today. I'd like to introduce Angie Galarakis. Angie is a certified health coach and yoga teacher who has expertise in teaching yoga nidra, guided meditation. She's also an advocate who has a passion for wellness and stress management. So we're so glad to have her with us today. We encourage you to drop your questions in the chat if you have any, and we'll make sure we make time with Angie to get those questions answered. Angie, thank you for joining us today. We'd love to hear a little bit more about your background and passion for this work, and then please feel free to dive right into our session content today. Thank you.
Thank you, Lauren, and I appreciate you inviting me today, and I look forward to hearing from folks at the conclusion of this presentation. Just a little heads up, when I do my presentation today, this is kind of my sidebar note to you, I wanted to share a little bit about myself, where and what motivated me to pursue meditation as a way of finding space to create calm and peace. So wanted to give you an awareness of where I come from in terms of my experience with cancer. I'm going to assume, excuse me, I'm going to assume that all of you have experienced some type of stress. And for some of you, it's a stress that has felt unmanageable, mind-bending, and downright frightening. We know from research that people who have cared or have had cancer or a serious life-threatening disease will likely experience tremendous stress. And that type of stress can make it difficult to deal with daily life. We know that cancer survivorship brings a whole host of potential side effects, such as secondary cancers, PTSD, depression, neuropathy, acute pain, chronic pain, immense fatigue that makes it so difficult you can't do your daily chores, your work, you can't care for your partner or your children or other important people in your life. I have witnessed this stress firsthand as a caregiver to my son, Stephen, who is a 4-time cancer survivor and who has experienced most of the cancer treatment side effects. Stephen was diagnosed in 2006 when he was 15 years old with stage 4 osteosarcoma. He was very fortunate because he survived the treatment that included rigorous chemotherapy, 2 spine surgeries that required his L4 to be removed and replaced with a cage and some screws and bolts, and then had radiation therapy and then more chemotherapy. It was a long, scary 10 months of hospitalizations, ER visits, crying, laughing, and more crying. However, he survived. In my mind, I figured that this was the end of the cancer experience. We were so happy to have him home, being a teenager and all its wrappings. In 2008, he graduated with his peers and was ready for college. And although there were a few bumps in the road that required some surgery, all in all, he was okay. We had started to resume some semblance of normalcy with Stephen starting college in the fall of 2008. And my husband and I felt so gratified that he was on his way in the world. In November of 2008, after a routine blood test, Stephen was diagnosed with secondary acute myelogenous leukemia, or AML, that was the result of the treatment that he received for his osteosarcoma. Needless to say, we were devastated. And the only thing I could think about is how to support my son and keep the rest of my family intact and sane. Once again, our lives came to a screeching halt. The stress was immeasurable. I really wanted to stop speaking and stop seeing people. I just wanted to be with my son. My now 19-year-old son was being informed that he would need a bone marrow transplant and that it could kill him or save him. And although we were informed that the side effects could be mild, chronic, or severe in the skin, gut, eyes, or liver, we had no idea what to expect. I knew I had to stay sane, so I pursued healthy meaning-making by staying in the moment, dealing with the moment, remaining prayerful, and knitting really long scarves and not thinking about tomorrow. But it wasn't easy. Stephen went through high-dose chemotherapy to destroy his disease cells and weaken his immune system to prevent his body from rejecting the donor cells after transplant. Stephen had long-term hospitalizations. Stephen tolerated me taking him to an energy therapy treatment session. We flew to Arizona with a PICC line attached to his body due to a port infection to meet with a very saintly person for a special blessing. He attended, when his health permitted, family-run bone marrow drives to locate a donor. He waited to find his bone marrow donor. He learned he had an allogenic donor, and he had his blood type changed in an apheresis machine to match his donors. On transplant day, or day 0, it was remarkably uneventful. Stephen was sedated. Our priest blessed the bone marrow. We all sat, cried, and prayed while the marrow was infused into his body. The following days were calm, and fortunately, he didn't have any severe health issues, and ultimately, his body did accept the marrow. It engrafted. After many, many days in the hospital, Stephen was released to go home. We were given several pieces of information to guide us through the post-transplant process, but nothing, frankly, prepares you for the post-transplant process. Due to our uniqueness as humans, there is no telling what to expect, and our entire family had to enter into a new normal, a term which I have grown to hate. As a caregiver, a new normal meant sanitizing kitchens and bathrooms, no raw food, no salad, no fruit, no pets, no plants. I won't elaborate on Stephen's experiences, only to say there were many, many visits to the ER, several visits to medical specialists, and he was continually exhausted, in pain, and not knowing why. After his bone marrow transplant, I asked one of his doctors familiar with his case if Stephen would be forever cancer-free following a successful transplant. His response was that there was no guarantee, and that I should view each day as a blessing and appreciate the moment. I don't know exactly how long or when it took me to process all that information, but I knew that I had to do something to keep my son from relapsing. It was at this time that I felt I was living on the edge of a precipice, and in Joan of Arc style, as though I had a flag in my hand and waving it to anyone and everyone whom I interacted with, I had to state that this cancer my son and other young people were suffering from was simply unacceptable, and something needed to be done about it. My job, as I thought, was to make things better and to find a way to make things better. But how? Here are some very sobering statistics. Did you know that 15,780 children under the age of 19 will be diagnosed with cancer this year? And that every 3 minutes, somewhere in the world, a parent learns their child has cancer? And it is estimated that in 2022, 87,050 teens and young adults between 15 and 40 years of age will be diagnosed with cancer. And for the 85% of those children, teens, and young adults that survive, the chances of them experiencing some type of post-treatment effects are very high. For example, 95% of childhood cancer survivors, and that includes children under the age of 19, will have significant health-related problems later in life. For the young adult population, I didn't have a statistic because typically they break it down, the statisticians break it down into diseases. Maybe one of you folks have that statistic, but I couldn't find it. Regarding caregivers, a person like myself, in one study that I found, 47% of the participants expressed having depression or anxiety. Needless to say, cancer survivorship comes at a price for patients and caregivers. So what to do? What should I do? This is the thing that I was thinking about. As an educator, I sought to use my skills as a teacher, a counselor, and a researcher to find the best way to help others. I wanted to make sure that I could educate as many people as possible so that they could take control of their life that would hopefully change the trajectory of their experience with cancer, where hope was a reality, where a sense of peace was a reality, and a good quality of life was a reality, and not just something to write about in an academic journal. I knew I couldn't cure cancer, but I also knew that perhaps I could make a difference in helping others. As a person who has been a professional counselor and has worked with people in crisis, I knew the importance of finding a sense of calmness, peace, and acceptance. When we find acceptance in whatever is happening in our life, we can then create a model for ourselves as to how we're going to deal with this crisis, this pain, this sadness. Meditation is a tool that helps the individual find and experience calmness and peace. The National Institute of Health's Center for Complementary and Integrative Health reports that practicing meditation or mindfulness may help people manage anxiety, stress, depression, pain, and symptoms related to withdrawal from nicotine, alcohol, and opioids. Yoga Nidra meditation, as defined by Swami Satyananda Saraswata, is a systematic method of inducing a complete mental, physical, and emotional relaxation. The word yoga means union or a one-pointed awareness, and nidra means sleep. It's like an awake sleep, where the consciousness is functioning at a deeper level of awareness. It is a relaxation with inner awareness. The integrative restoration Yoga Nidra, or iRest Yoga Nidra meditation, was founded by Dr. Richard C. Miller. His research demonstrated a positive impact on veterans with PTSD who have participated regularly in Yoga Nidra meditation. This research took place at Walter Reed Army Medical Center. Although his research was demonstrating positive effects for the service members, the term Yoga Nidra was unfamiliar in military circles. So Dr. Miller was asked to change the name and use language that was more secular in nature. So Dr. Miller selected integrative restoration. He believed that with the word integrative, it meant that the iRest program would help the individual be fully functioning and integrated and a healthy human being. And restoration, because it helps you recover peace and joy and well-being, and that it would help you feel more connected to yourself in all of your life. This is the meditation program I pursued because I felt it to be effective for cancer survivors and caregivers, because we have all experienced some form of PTSD. The style of meditation, or the language used, the way the teacher is instructed to approach the session, creates trust and security for the participant. As teachers, we do not tell you what to feel or what to experience, because we are all unique. And because when someone has experienced a trauma, we as teachers don't know the triggers for that individual's trauma. That's why it's so important to allow the individual to select where they feel safe and secure, how and where they feel love, and what motivates them to do what they do. In iRest Yoga Nidra meditation, we learn to observe, welcome, and engage in various aspects of our waking existence, starting with the most basic, the physical body, and all the subtle layers within us, which include our breath, our feelings, our emotions, thoughts, joy, and awareness. In iRest Yoga Nidra meditation, we are invited to welcome everything present in our body. And as we do so, our emotions and thoughts can begin to grow calmer. Through this process, we discover and connect to the aspect of ourselves that is always peaceful and at ease. And like all learning opportunities, the more frequently you practice meditation, the better you get at it. There is repetition in the language you hear from the teacher, and that repetition helps the student become more engaged with the meditation experience. It is important to remember that each of us are unique and will experience meditation differently. Some will fall asleep, and that's okay because you're exhausted. I had one of my students fall asleep during a group session at a yoga studio, and he was snoring. And in order to get him to stop snoring, because he was really disturbing the class, I moved closer to him and spoke a little louder, but no response. I tried again. It didn't work. Finally, I just gently touched him on the shoulder. No response. Finally, his wife opened her eyes, reached over, and gave him a little pop, and he rolled over and stopped snoring. At the conclusion of the session, he came up to me and said that that was the best sleep he ever had. So obviously, he needed it. I believe that meditation can be an opportunity for personal growth, and it has been for me. During meditation, you are asked to relax, get comfortable, and notice your surroundings and accept them. You are asked how you feel. You are asked to reflect on your heartfelt desire, that energy that drives and defines who you are and what you want to accomplish right now in this moment. You are also asked to set an intention, which is a positive response tensed in the present, so that it could sound like this. You asking yourself, excuse me, what do I want to do right now? Why am I here? You will also be asked to find that special place in your mind and heart where you can find peace and safety. This is called your inner resource. Your inner resource can be a person, place, or a thing. It's a belief, or it can be a belief. It could be a place you visited just once. It can be a person that you deeply love, or someone or something that makes you feel really good. I have had many aha moments during my personal meditation sessions. I have learned that I am okay just the way I am, that I don't have to prove myself to anyone. I can put my Joan of Arc flag away and do whatever I can within my abilities and my life constraints. Meditation has opened my heart to a transcendent love that I never knew existed. My inner resource is such a blessing to me. Meditation is an opportunity to develop a higher sense of awareness and an appreciation for the moment you are in right now. It is an opportunity to accept the nice and not so nice events in your life. To be able to set aside those sounds, those distractions that are pulling you away from who you are and who you want to be. You learn that you have the ability to change how you think and react, and to create space and allow your mind and body to find peace and acceptance for what is right now. When we settle for that space between who we are and who we want to be, we find acceptance and equanimity. In describing living in that space, Mark Nepo writes, "While a tree is all leaves, the life of the tree is in the spaces filled with wind between the leaves. And while we are the sum of our actions and words, the life of who we are is in the spaces between our action and words. So you see, we are the energy, we are in control. We have the ability to create peace for ourselves. I appreciate you allowing me to share a little bit about my personal experiences with cancer as a caregiver. I am no longer a caregiver. My son is 32 years old and he's doing okay. He's had a few scary encounters with cancer recently, but fortunately, he only required a few surgeries. Not so only, but you get it. He has a good life, and for that I am very grateful. My Joan of Arc flag is in the closet. I still possess strong feelings about cancer experience. Ask anybody who knows me. And sometimes it's really hard for me to keep my mouth shut, but at least I am more aware of what I'm doing and why. I have realized how sweet and brief life is, and I intend to continue to grow as a human being who cares about others. Thanks.
It does look like we have a few questions that came in, so I would like to take a moment to share those. Let's see. One of the questions that came in is, what are some of the ways I can turn off the noise in my head to focus on meditation? I'm not good at that part.
You know, that's a challenge, okay? And we all react to distractions differently. I think one of the most important things you can do for yourself is to say, these noises are really distracting. These moments are really upsetting me. If we don't acknowledge what we're feeling, it will never go away. It's like the person who's laying there saying, okay, help me find some calm now. I'm laying here, you know, how come I'm not finding calm? And I've had people say that to me. You have to be willing to truly let go. And that takes practice. It might only be for a second. You know, there's an exercise that Thich Nhat, and I can never pronounce his name, a Buddhist monk, but he gives an example of something you can do to help yourself. You can sit in a comfortable position and speak to yourself. You can say it out loud and just say, I am breathing in. I am breathing out. And only think about that moment. And it becomes something, if you can do that on a regular basis for yourself, when you find yourself in those moments, perhaps it will help you. It's a very small example, but it's just one example. And some of the resources I shared give you some other ones. And I think that for those of you who will be staying on to listen to the meditation session, you might hear a little bit more about that as we go through it. And certainly I'm happy to answer any questions in the future.
Thanks, Angie. Another question that we had here, is there sort of a mini meditation or a short exercise you can do if you have limited private time or space?
Sure. I think one of the most important things that people are instructed to do in those moments is to truly sit down, again, take in what's going on around you, accept it and release it, do a few deep breaths, and do, if you can, a body scan, you know, starting with the top of your head and going all the way down to your toes. I have found that very helpful when I can't fall asleep at night, and it works. You know, you have to, you know, say to yourself, okay, I am going to start with the top of my head and go all the way down. Relax my eyes, relax my ears, my jaw, my neck, and take a deep breath when you can. Breathe normally, feel your belly, put your hands on your belly if you can, and allow that breath to just enter into your body. Those are the most simplistic things you can do. Some people just want to take a walk. You know, if you can just take a 5-minute walk just to clear your head, that helps. And I did that a lot when my son was in treatment.
Right. Yeah, thank you. I know my coworkers and colleagues at Grit Health know that if it's 75 degrees and sunny, I'm gonna go outside for 5 or 10 minutes and reset. So I completely understand that one. One of the other questions that came in is, how do we get in the right headspace when you're not feeling well physically?
You know, that is really a very good question, because let's face it, it's not uncommon, right? I think finding the most comfortable position that you can be in and telling yourself, I am going to just, surround myself with my softest cushions or my pillows. I know sometimes you may be in a hospital, find some acceptance, for where you're at, okay? And say, I am feeling pain. This pain is distracting to me. How can I accept this pain? And as you do your body scan and talk to yourself, self-talk is very healthy, and say, I am going to find some peace here. It's not always going to work. I'm not going to say, boom, you're better. But hopefully, even if it's just within that 10-minute period, that there was 1 minute where you just let go, that is a good thing. Okay.
Right. Thank you. That's great information. I know something that would help me along in this, right, is that acknowledgement and acceptance rather than just staying hung up on it. Take it in, let it be, let it go.
It's hard.
That moment.
It's hard.
Exactly.
Yeah.
Wonderful. Well, thank you for answering those questions. Now is the moment where we all get to focus on ourselves for a bit. So we're really excited to have you, Angie, guide us through a meditation exercise. And when that wraps up, I will come back on. So when you're ready, Angie, go ahead and start us off. Thank you.
Thank you. As we're about to begin with our meditation session, I'd like to invite you to find the most comfortable position that you can be in at this moment. Whether you're sitting or lying down, make sure your body feels supported. For example, if you're sitting, make sure that your back and your shoulders are relaxed, that your tummy is relaxed, your hips, your knees. And if your feet are dangling from the chair, put a book or some object under your feet to keep your feet secure. If you're lying down, consider supporting your neck and head, and possibly have a bolster or a pillow under your knees so your back stays relaxed. Sometimes it's helpful, especially this time of year when we're in an air-conditioned environment, to have a blanket on hand, because when we meditate, our bodies do cool down, and that can be a distraction. So have a blanket on hand. I often like to just kind of put myself into a cocoon with my blanket and my pillow and just lay there and meditate. So now that you're a little settled in, I'd like you to reflect on this one fact. There are 30 trillion cells encompassing your body. And each time you inhale and exhale, you are generating an energy that travels through those 30 trillion cells. Everything that you have been, that you are, and are willing to be in the future are contained in these cells. So take a moment and feel your 30 trillion cells while you breathe naturally. Can you feel the cells in your face, your shoulders, your arms, torso, hips, legs, and feet. As you feel those 30 trillion cells, be aware that the more we understand how our body and mind functions together, the better we can understand and accept who we are and feel greater self-compassion, because we are only human. And as humans, we require balance, peace, and ease. And now see if you can make yourself 10% more comfortable. Do you feel supported? How about your neck, your back, and your arms? Make sure you are as comfortable as possible. Your eyes can be opened or closed. Just find the most comfortable way to be. Allow yourself to notice the sounds coming and going in the room. The sensation of the air touching your skin. Recognize any thoughts whirling around in your mind and welcome them. And then release them, let them go. Notice your breath as you naturally inhale and exhale. Feel the flow of air, entering and exiting your nostrils. Feel the rise and fall of your belly and chest as you inhale and exhale. Now, imagine your breath contains all the energy that you possess. You could call it an energy ball. So as you inhale, imagine this energy entering your body, holding it for a brief moment, allowing this energy to expand throughout your body. And then as you gently exhale, release the energy. So let's try this together. Take a deep breath in, bringing all that loving energy into your body. Hold and let it expand throughout your body, and then gently release it, allowing your abdomen to relax. Again, inhaling, bringing that energy into your body, expanding into every cell. Hold it for a brief moment, and then gently release it, allowing your abdomen to relax. Practice this deep breathing 3 more times at your own pace, knowing that with each breath, you are energizing each bodily cell. And then return to normal breathing and settle into your body once again. Now that you've had a moment to relax, reflect on this energy ball. How would you describe this energy? How did it feel? What did it feel like? This energy ball can also be referred to as your universal life force. Your universal life force is everything that defines the inner you and how you respond and interact with the world around you. Your universal life force is made up of your heartfelt desire, your intention, and your inner resource. Your universal life force is always reflected in a positive statement in the present tense and is true in this moment. So let's start with your heartfelt desire and ask yourself, what embodies who I am right now? What drives me to do what I do? Remember, this is a positive statement in the present tense, and it's true in this moment. Some examples: I love life. I live my life as an authentic and compassionate human being. I am healthy. I am important. I am safe. Now, identify your intention for today's practice. Your intention is also a positive and present statement. For example, I am here to find peace and calm. I am here to learn to meditate. I will relax. I am relaxed. So take a moment to identify your intention. Now, set aside your heartfelt desire and intention and prepare to select your inner resource. Your inner resource is where you feel safe, at peace, and at ease. It is a place that brings you warmth and joy to your heart, body, and mind. It is a place where you can return anytime you need to take a time out and rest and feel secure again. It's a place when you can return to whenever you feel an overwhelming emotion or when you feel pain. Your inner resource can be a place, a color, a special belief, a symbol of faith or security, or a moment in your life when you felt secure, safe, and calm. Remember, it can be whatever you feel is appropriate and best for you. So welcome your inner resource, that feeling of safety and security. Now, I'd like you to take one of your hands and close it into a tight fist. Squeeze it shut. This is what it is to be hard and stressed. Notice how the blood in your hand is blocked from its proper flow because it's too constricted, too misaligned. If you hold that fist long enough, life will drain from your hand. It will go numb and listless. Now, slowly open your fist without any effort and notice that the blood is rushing back to feed your hand with loving energy. A loving source floods back into you. It is effortless, easy, and limitless. It is full of grace. You see how your mind and body work together just now? You are the source and you are in control. It's always up to you to be there to support yourself and serve yourself. So as we breathe and scan our bodies now, we will release tension and always remember that you are in control. So let's scan our physical body. Start by feeling all the sensations in your mouth, teeth, tongue, and jaw. Feel your left ear. How does it feel? Can you localize the sound to that ear? Feel your right ear. How does it feel? Is the sound different or the same as the left ear? Now allow sound to enter both ears and experience them as radiant sensations. Feel your right eye, your right eyelid. Feel your left eye, your left eyelid. Feel your closed eyes as they're resting in their eye sockets, safe and relaxed. Feel both eyes as a field of radiant sensations. Feel your forehead, the center of your forehead. Feel the tension in your left side of your forehead. Feel the tension on the right side of your forehead. Feel your scalp. Can you sense the air touching your skin? Feel your head, jaw, mouth, teeth, and tongue. Gently move your jaw. Open it just enough to release tension. And so that your teeth are not touching each other. And allow your tongue to gradually glide around your teeth. Feel your neck, the right side of your neck, the left side of your neck, the front of your neck, the back of your neck. Feel your entire head, neck, inside and outside, all as a field of radiant sensations. Feel the muscles in your right shoulder, right arm, elbow, wrist, hand, and fingers. Feel your left shoulder, left arm, elbow, wrist, hand, and fingers. Sense both shoulders, arms, elbows, wrists, hands, and fingers, all as a field of radiant sensations. Sense your entire torso, front and back, and feel that your entire torso is a field of radiant sensations. Now release all thinking and feel the inside of your body. What does it feel like? Now feel the outside of your body. Your left hip, your leg, your ankle, foot, and toes. Your entire left leg. Feel your right hip, leg, knee, ankle, toes. Your entire right leg. Feel both legs, inside and outside, as fields of radiant sensations. Feel yourself as the observer of these sensations. Feel your head, neck, shoulders, chest, back, waist, hips, pelvis, thighs, knees, legs, ankles, feet, and toes. Observe all the sensations inside your body and outside your body, the sensations above you and below you, your left side and your right side. These sensations are your way of paying a loving attention to yourself. So say to yourself, I am aware. I am resting. I am at ease. Feel your body breathing itself. Your universal life force, your energy is moving within you and through you. Feel the flow of sensation in your nostrils and throat, the gentle rise and release of your abdomen, the gentle rise and release of your chest, releasing tension through your entire body with each inhalation and exhalation. Feel your beating heart and your breathing lungs, the source of your self-compassion, the source of your energy that takes care of you. And know that as you inhale and exhale breath, the rhythm of your compassion moves within you, flowing into your heart and throughout your body. Welcome all these experiences simultaneously and feel as though you are witnessing them with true awareness. Continue to breathe gently, inhaling and exhaling, and release all the tension that exists in your body. Feel as though your heart is like the sun that emanates or exhales warmth, a warmth that you feel throughout your body, a warmth that makes you feel as though you have fallen into the arms of God, the divine, or someone you love. And know that this love has the power to transform you and release you. Know that this love is your truth and your connection between body, mind, and spirit. So bask in that love and light and simply be, with nothing to do, nowhere to be, undeniably loved, aware and at ease, and experience everything just as it is. You are home. Feel that sense of spaciousness. Feel that sense of being and experience everything just as it is, fully aware and open to oneself. Now, welcome into this spaciousness your heartfelt desire, that which embodies who you are and what is most important to you, and sense the truth that in every moment your body and mind will always know the perfect response in each situation in life. You are in control. You are at ease. When we live in this state of equanimity and deep state of peace, we live with grace and calm. Now, slowly begin to sense the room and the surrounding sounds, and imagine going about your waking life to what is unfolding around you. Your fist is open. Your energy is released through your body. You are awake. You are aware. You are open to life. Begin reorienting yourselves to where you are, to what you may be doing. Take time to stretch and rub your hands together and wiggle your toes and blink a few times, but take all the time you need and feel yourself grateful for taking this time for yourself, your health, healing, and awakening, and the practice of Yoga Nidra. May peace and good health always be with you. Thanks.
Angie, for taking the time to guide us through not only why taking care of ourselves is so important, but really giving us some strategies and going through this meditation with us today. It's been extremely beneficial, and I know for me it was a really great way to spend part of my day today. Any final words, Angie?
No, if you have any questions though, please feel free to reach out to me. You can find me at Angie@elephantsandtea.com.
Wonderful.
And also, we do not happy hours, that's a different thing, but we do have meditations, and they call it Meditation with Mama G, and we'll be resuming those pretty soon. So feel free to join in and bring your friends. It's okay.
Awesome. Thank you so much, Angie. We also want to thank our interpreters today, Emily and Mackenzie. And of course, we want to thank all of you for joining us today. I know it's not always easy to give yourself permission to focus on you, but we're so glad that you did that with us today. And we hope that you can take some tools from today's session to keep yourself centered as you go out and keep changing the world. We'll be hosting our next session of the Advocacy Exchange on Thursday, September 1st, where we'll be discussing caregiving and mental health. So please watch your email and social media for more information about that upcoming session. If you're interested in viewing prior sessions or for more information on upcoming events, please visit theadvocacyexchange.com for more information. Thank you again, Angie. Thank you again to everyone who attended and joined us today. I loved it. I loved being here and moderating. So I hope everyone has an enjoyable rest of your day and a wonderful rest of the week. Thank you.
Thank you. Take care, everyone.